Welcome to Dr. Sogge on the art and science of thriving. Here, we explore cutting edge psychological science on human flourishing and ancient wisdom teachings on the art of creating a flourishing life. I'm Dr. Kimberly Sogge, a scientist, practitioner trained clinical and health psychologist, and I'm on a mission to help you realize your full potential. Welcome, everyone, to the Art and Science of Thriving, where our intention is to explore transformative pathways to well being, flourishing, and mindful living. So, today we're diving deep into a topic crucial to all of us, the intersection of mindfulness, climate action, and human thriving. And our special guest is Dr. Bruce Barrett, a pioneer in mindful climate action and a leading voice in understanding how planetary health directly impacts human well being. So, Dr. Barrett is a family physician, a researcher, an educator at the University of Wisconsin-Madison. My favorite professor in my PhD program was trained at University of Wisconsin-Madison. Dr. Barrett directs the Mindful Climate Action program. He has a distinguished career spanning family medicine, integrative health, and public health research. Dr. Barrett has dedicated his work to understanding the profound links between human health, mindfulness practices, and environmental sustainability. His innovative research explores how mindful awareness and compassionate action can catalyze meaningful responses to the climate crisis, ultimately promoting well-being for both individuals and the planet. Welcome, Bruce. I'm so excited to speak with you today.
Thank you, Kimberly. I'm very happy to be here.
Bruce, can you share a bit about your personal journey? How did mindfulness and climate activism become interconnected in your life and career?
I think I've always been a lover of nature, a tree hugger, so to speak. My parents took me into the wild and out on boats and in mountains. I learned about mindfulness, I think, in the early 2000s and took the John Kabat-Zinn MBSR course and then did research in that area. We did two trials we randomized people to mindfulness, to exercise, or to neither. So they had 8 weeks of training in either physical activity or in mindfulness training. And then we followed them for a year, most of a year, and we were looking at respiratory infection and the immune system. And those two trials showed rather definitively that both exercise and mindfulness training and practice can reduce the incidence, duration, severity, and impact of all-cause respiratory infection. Then we've just completed a trial colleague Alexandra Zagierska designed, but I became the dual PI on it, and it showed that mindfulness-based stress reduction training for chronic low back pain was just as good as standard cognitive behavioral therapy. We had 770 people with chronic back pain on opioids, severe pain, with significant dysfunction at 3 different sites in Utah and Boston and in Madison. They were randomized either to the mindfulness or to the CBT, and they all improved function, decreased pain, and reduced opioid dose.
Wow.
It was just published in JAMA Open a few weeks ago. So I've been into the mindfulness research space for a while. When I learned, or when it finally hit me, that climate change was the largest single threat to human health across the globe for the next foreseeable centuries, I couldn't do anything other than change my career direction to try to figure out ways to help. And because I had the background in mindfulness, of course, that's what came to mind. And we started developing a program to help people change behaviors to both improve mental and physical health and to decrease carbon footprint. And it became very clear that the same behaviors that help people be healthier and happier also help reduce impact on the environment. The walking and biking rather than driving, using stairs rather than elevators. Eating lower on the food chain is a big one. If you eat meat 10 times, 15 times a week, and you switch out most of that to plant-based proteins, you have a lower risk of dying. You have a lower risk of hospitalization, heart attack, stroke, all this stuff. And you substantively reduce your carbon footprint, helping the planet be healthier. So all of these win-win, low-hanging fruit scenarios just kept popping up. And while we haven't shown definitively that mindfulness training reduces carbon footprint, I think we will end up finding that when enough good research is done.
I'm really loving how you seem to pendulate back and forth between looking at mindfulness-based interventions for direct alleviation of human suffering, and then it seems not separating it out from direct alleviation of planetary suffering. You have a pretty big patient here if you're taking on the planet as your patient. And I'm curious from your
Mm.
research and also your personal practice, because I feel there's two really interesting veins to mine here, is how does mindfulness specifically help individuals be more effective in their responses to climate suffering?
I think in several different ways. One is the mental health effects of knowing about climate change. It's overwhelming. If once you understand the magnitude of the threat to humanity and to half of the species that live on this planet with us, you can't help but be stressed and have anxiety and maybe have depressive symptoms around that. Mindfulness practice has been shown conclusively to be as good or better than antidepressant or anti-anxiety medications or to cognitive behavioral therapy, other standard psychological techniques. So we know with dozens of trials and thousands of participant patients in those trials, the effects of mindfulness, positive effects on mental health. So that we think will help with the mental health effects that come from understanding climate change. So that's one place to start. And then the other place is with daily choices, making choices and turning them into habits in ways that help yourself and others. And uh, data is less robust in that area. It's hard to study behavior change. You can't blind mindfulness training.
Right.
Um, but it sure seems like people who continue to practice are able to improve their bodily health as well as their mental health. A lo- Whether being randomized to getting the training statistically changes behaviors is yet to be proven. Um, but it sure looks like at least the people who continue with the practices end up with healthier behaviors, which can support their own health and can make them better partners with the other living beings on this planet.
Mm. I think it's certainly true that given the enormity of the climate crisis, many people feel overwhelmed and immobilized. I was actually seeing patients before I came in to chat with you, and this is pretty commonly a theme where people are talking about there's the overwhelm of my individual story, but this larger story is just
Mhm.
adding this extra burden that tips some people over the edge in terms of being able to cope and be appropriately resourced and then into overwhelm. And I'm curious, how do you see mindfulness practices helping transform those feelings of overwhelm and despair into maybe a more empowered or compassionate response rather than overwhelm?
So I think when people are empowered and take action, their symptoms improve. So we have a theoretical structure that kind of comes from the trans-theoretical model, the stages of change model, where which was, as I'm sure was developed mostly in addiction, where people can be having no plan to change their addiction, being in denial, or they can want to, but not have a plan. They can have a plan, but not enacting it. They can have a plan and be enacting it. And then they can either relapse, hopefully not, or maintain that sobriety or that healthy living. And so we think it's probably similar with pro-environmental behaviors.
Mm.
Most everyone, more than 80% of people, consider themselves environmentalists and care about the environment and want to have a thriving ecosystem and want to have sustainability. If you actually spend some of your time and effort towards that, if you move towards activism, then you feel more empowered and less overwhelmed.
Mm.
Or at least that's the theory. Again, we need more and better research, but that's the guiding theory that we're following.
Yeah, I'm really excited. The psychologist part of me is excited that this is Prochaska and DiClemente's work that you refer.
That's right.
I think,
That's right.
yeah, I think there's a trans-theoretical application to building community resilience in the face of these climate crises. And I'll be honest, like part of why I started exploring what programs are out there, and I was very excited to see that you'd taken the initiative to develop this mindful climate action program, was you might have heard or maybe even experienced a few summers ago when there were massive wildfires in the north in Canada. I think some of the smoke reached as far south as you, or at least friends in New York City were calling me saying, "Is everything okay? Because the sun is red."
Oh yeah, we had bad air quality here in Wisconsin
You
from
experienced that?
those wildfires in Canada. Oh, absolutely. It raised awareness of air quality issues tremendously.
Yeah.
Yes.
Yeah, and I had family up in some of the places where there were evacuations going on and colleagues. And really, I would say most of the communities were just blindsided by it. And the reason why there, if you've read the book Fire Weather by Jean Vaillant, a Canadian writer, he went to the communities and interviewed them about what enabled you to survive this and what are the key elements to communities having resilience in the face of these massive catastrophes. And it was basically no governmental or structural program was there. It was really people's relationships and just the common humanity within a community. So that's why I started getting really interested. What are ways we can intentionally build um, or strengthen some of these processes in communities? And Mindful Climate Action Program was one of the few programs I could find out
Mm.
there. Could you talk a little bit more about that program and what your plans or hopes are for it? Because I think that there's a lot of room for communities to begin to implement resilience strategies that will help them face whatever's going to happen. Nobody knows what it is until it actually happens. In fact, I remember I was finishing my PhD working in the dean's office at the Texas A&M College of Medicine when Hurricane Katrina hit.
Mm.
And I remember standing there watching the television with him, and we realized there was going to be busloads of patients coming up the highway from Houston towards College Station, Texas. And I said to him, "What are we going to do?" And he said, "I don't know. I'm going to call my friend who's the dean down there and find out what they're doing, and maybe we can coordinate." It was genuinely just human relationships that allowed a response of some kind.
Yeah. Katrina was really a wake-up call. I was actually scheduled to give a talk at the American Public Health Association meetings in New Orleans that week. That
Wow.
that conference was canceled, of course. but a huge wake-up call. So you're really asking two things here, and one of them
Yeah.
is community response, and that I think is going to be essential regardless of mindfulness. You could
Yeah.
throw mindfulness away, and we need to have a strong public health training. We need to have cooling facilities. We need to have air quality monitors and available real-time information. We have to have particulate masks that can help allow people to even work outside when the air is bad. We we have to have ways of finding the individuals at most risk. I've just seen a really great investigation on elderly people in Paris during the heat wave that killed so many thousands of people there, and it was lack of social contact that got people. If you had a person or that was checking in on you, you could be saved. There are so many things we're going to need to do to deal with the heat waves, with the flooding, air quality issues, with decreased availability of nutritious food, with the frequency and intensity of storms, both hurricanes like Katrina, but also cyclones and windstorms and firestorms, mudslides. There's going to be an increased set of challenges, and we have to develop a robust infrastructure. So that's governmental work. That's
Yeah.
also in corporate work, and that's community work and state work and local work. So there's all of those are absolutely necessary, regardless of the individual trainings to help people become more resilient.
Mhm.
The second thing, or maybe it was the first thing you asked,
Yeah.
is the structure of the mindful climate action course.
Right. Yes.
So we copied and pasted some of the mindfulness-based stress reduction course that John Kabat-Zinn et al. Created 35 years ago. So we started out with an 8-week course with 2-hour group meetings once a week. I'm now using that course in the medical setting with patients, UW Health patients. And there we roll it out as a 6-week or a 7-week group medical visit with 2-hour classes each week. It follows a ecological theme structure. So each week has a new theme. If we're doing a longer version, then we might just do introduction to mindfulness the first week. If we're doing a shorter version, we'll go right in with air. And we learn breath meditation, breath awareness. That's always with you. Breath, you can
Right.
always use breath as a calmer, centering. So breath meditation, and then knowledge about air quality. We have one of the world's top air quality scientists who's done a 10-minute video on air quality. So the group watches that and then discusses it. So out of the 2 hours, we watch a video and discuss it. That's a total of 20 to 30 minutes. And then most of the hour is spent practicing mindfulness practice and breath meditation for that week. The next week, the theme is water. And there we see a meteorological scientist, expert in water, who gives a short video describing hydrological cycles, the importance of clean water, importance of water conservation in some areas. And then we discuss that. And then we do water-based meditations. There's lots of them. The pebble in the pond and the ripples. And there's ways to imagine ways to do water in the shower or at your sink. There's ways to do sipping of water and use that as a meditative medium. The third week, we do food, and we learn about the ecological and consequences of various types of food production, transportation, packaging, and consumption. And we learn why it's so much healthier to be eating a plant-based diet, not only for the individual who has less cardiovascular risk as a result, but for society that has less, primarily methane. Cows, I'm in Wisconsin. We're a dairy state. Cows are
Okay.
very cute and
Cheese
cuddly.
heads. Yeah.
I love cows. We're good cheese heads. However, cows belch up a huge amount of methane, and there's close to 1 billion of them on the planet. And so just that one species that we tend is contributing substantively to climate change. And if we eat less of them, we will help protect the planet. Then the next week, so we've done air, then water, food. The next week we do movement. And there we talk about transportation, we talk about bicycling versus cars versus buses and trains, and the health benefits of active transportation and of moving one's body. So we then do walking meditations for most of the session, but we also watch a video and discuss those issues. And then the next week, we do nature awareness, nature immersion. There's been lots of research coming out the last decade or two on the benefits of spending time in nature.
Mhm.
So we do nature-based meditations, hopefully outside. Here in Wisconsin, we do a little bit more time outside if it's spring, summer, or fall than deep winter, but you could do outside meditations any time of the year. And you can learn the benefits of spending time in nature and appreciating other species. You can do that with your cat or with a flower in your or a house plant, or even with videos about nature or just mental imagery of nature. We end up, the final session is always about values or
Okay.
ethics. It's about, why does your health matter to you? Why do you have a healthy lifestyle? Often that comes out to helping those around you. It's, I want to see my grandchild graduate from college, or I want my spouse, I want to be healthy for him or her. And sometimes it's for the planet. I, I my values are that I want to leave the planet better than I found it. That hasn't been happening. I want to contribute to a better planet. So it's really a discussion of individual values that motivate our choices, and then hopefully our choices translate into behaviors, and then hopefully those become habitual or standardized so that we can maintain the healthier behaviors that are concordant with our values.
I'm sitting listening to you and like noticing joy that rather than responding with overwhelm or denial, you've really leaned into this as a physician and as a human being. Haven't How can we use the skills and knowledge and tools that we have to just face things as they are? And I'm really appreciating how you're integrating personal well-being and thriving with planetary well-being and thriving. Do you see any separation between those two concepts?
Usually they're mutually reinforcing, but there are sometimes trade-offs. Sometimes do, there are things that are not necessarily good for both. So we concentrate on the ones that are, and those mostly come down to movement and eating. But there's also lots of things like purchasing. I don't know about in Canada, but here in the US, when I grew up, our towns were not surrounded by all of these storage facilities because we had too much stuff. Now they are. And people are paying rent to store things that they will never use, and they're stressed about it. So learning how to purchase and maintain and reuse, recycle, reduce is the biggest thing. That can be helpful for mental health. Oh, so it's all related. Occasionally there are trade-offs. Yeah, and one thing has to be managed at the expense of another, but not usually. Usually
Mhm.
it's a win-win.
Mhm. What's your vision for scaling programs like climate action or mindful climate action to other communities or to other populations beyond those that you've researched so far?
Yeah, I really hope that we can. Am I've been in conversation with dozens of people around the world. Many places have taken our curriculum, but that's only affecting a few hundred people.
Mhm.
So, and then by ripple effects, maybe a few thousand people. The planet has 8 billion. Scaling is hugely important. there's a lot of research, especially coming out of here, Madison, Wisconsin, that shows that mindfulness, virtually mobile-based applications, health applications, can be effective. So that's traditionally MBSR has been taught in group session in person for 8 weeks. I think it's probably more powerful that way, but the research suggests that even small doses of mindfulness, even if they're taught via cell phone app, can be quite helpful.
Mm.
I would think we could incorporate such things into curriculum in schools. I grew up, there was gym class. There should also be mind class and
Mm.
mind body class, right? I mean,
Mind body class. I love
yeah,
it.
we should be learning that from kindergarten, how to be healthy and how to do these things. So I would think that scaling up through societal structures that already exist, corporations want their employees to be healthy, employees are more productive. So there's just a lot of incentive to do this kind of thing. Yeah.
I find as I'm listening to you, going to my friend who has for a long time trained family residents and works as, I think her title is Climate Action Champion in the Department of Family Medicine and the Faculty of Medicine at University of Ottawa. But I'm also thinking for years I've supervised and trained psychologists and other professionals in mental health. And how would you, if you were going to integrate it in schools, I think that's great. But also, how would you want to see professions, whether it's medicine or psychology or even law or other professions, how should they be integrating this kind of training into their curricula if this is going to be one of the biggest challenges faced by human
Mhm.
society in the coming decades?
Yes, we absolutely must bring education on climate change, environmental sustainability into all types of trainings. It's increasingly important in medical schools because we will be increasingly dealing with these intermittent disasters that will require robust emergency type of medicine, which we don't have as enough of right now. So there's that. I imagine that training of mental health professionals will require knowing more about this because of the profound effects. I think I saw an American Psychiatric Association nationwide poll suggest that more than 70% of US American citizens were mentally affected by climate change. Two-thirds had
Wow.
some negative health stressors, anxiety or depression or stress from the awareness of climate change. So I think we have to, as professionals, train our next generation to be aware of this. We also have to develop and validate methods that are effective. Uh, I imagine that most of the methods that are effective for anxiety and depression without climate change involved will also be when it's the cause. So I don't suspect that there'll be huge thing changes there, but we'll have to start incorporating awareness and testing out new methodologies. The, the, you have a universal healthcare system. Thank you for having that. I've been an admirer of Canadian healthcare for a long time. One of my mentors, Gordon Guyatt, helped me learn about that, and I read a lot. In the US, we've historically had a for pay for performance, but pay per visit, per delivery unit of healthcare. And so the economic incentive was to churn, to do more, because you'd
Right.
make more money by seeing more sick people. So if there's more sick people, you'd make more money. That's not the incentive. We want the incentive to be more healthier people.
Right.
Now that we're transitioning to a per capita preventive system, over half of our income at my health center is around population-based care. So people,
Is it? Oh, I
they
didn't
get,
realize that.
yeah, so we get paid to cover the lives of, let's say, 10,000 people. Now the incentive is to keep them out of the hospital,
Great.
which we have to be very careful with, because if we're doing that in ways that don't allow them to get appropriate medical care, that's wrong. But if we're doing it in ways to make them more healthy and resilient, such as mindfulness-based training
Mhm.
or provision of exercise training or nutritional guidance, all of those will, in the long run, keep people healthier and lower costs, and therefore make the healthcare systems more effective. So the alignment of incentives, I think, is really important. And if that comes around, the insurance companies, they're smart, right? They're, at least in the US, that's what pays for most healthcare. And they're, most of it is, not all, in fact, a huge amount is public, but a lot is private. And their incentive is to make money for their investors. And they're smart. So if they see that providing these preventive trainings to large numbers of their clients who have health insurance make them healthier,
Absolutely.
then they make more money because they don't have to pay for as many medical procedures. So I'm hopeful, even with unbelievably large threats that we're facing, there's a lot of things that are moving in the right directions, at least much of the time.
Well, I'm sure there would be those in Canada who have a lot of criticism. I have to say, I lived in the US for 16 years, and one of the reasons I decided to move my family back is it was a great equalizer to have free and fully accessible healthcare for all members of society. It's a real value of mine, and I think it does create a difference. And I'm excited also to hear about these models that you are implementing in Wisconsin of population-based health and how that leaves room for these preventative programs. That's really exciting. We have things to learn too, even in our system in Canada that provides universal care. It still is pretty reactive. I'm sure many people would say it would be great to see some of these proactive strategies
Mhm.
integrated. It's really exciting. I'm curious also, because I was thinking about how thinking about mindful climate action and how this can build resilience in communities. And from a public health perspective, there's potential there as well. But also, I know that mindfulness practice really makes me more available for thinking and approaching these questions without overwhelm, and even just being available and more resource to be with patients who are showing up facing the distress related to these situations. How does mindfulness practice influence you personally in your life? Do you bring these practices into your day to day life, or do you find it's more of a research and programmatic interest?
No, I've had a morning practice now for more than 5 years, maybe not a full decade. I spend anywhere from 20 minutes to an hour with a mindfulness practice that is movement based. I do mind body work at the same time. So I do my aspirations of gratitude and compassion while I am doing some Qigong movements and some breath movements. I'm double dipping. I'm trying to prevent back pain. I had bad back pain in the past and now I don't. And that's due to the movements, the yoga qigong movements I use are strengthening my iliopsoas and abdominal and other muscles and creating flexibility. So I'm doing a combined practice personally, and it's very helpful. It makes my life better. It doesn't solve all my problems. I famously 10% better. I think there's a group talking about that. That's probably about right. Right. Probably my life is 10 or 15% better due to my daily practice. I think it could be very helpful for healthcare personnel who have very stressful jobs. Um, One of our research postdoc trainees here, Sydney Tan, is a surgical resident, and she's taken off 2 years of her surgical residency to focus on research. And she has just conducted and completed a randomized controlled trial where medical residents around the US in few dozen different training centers were randomized to either getting a Healthy Minds app developed here by Richie Davidson's Healthy Minds group or not, or getting a wait list so they can get it a few months later. And the results are not published. I cannot go into any details at all, other than to say that she was able to recruit 550 medical residents and deliver the mindfulness app to half of them and then follow up on all of them with a whole number of mental health validated scales. And we've been doing that here. Dave Wrinkle and Vinny Minichello are both physicians in my department who have done quite a bit of mindfulness training and work over the years or decades. And we try to incorporate that and provide it to our family medicine residents in our program. I think it's necessary. That the life of a physician is so hard and so stressful. And to a large extent, same thing for a psychologist. You're
Right.
listening to people who are stressed beyond their gills and they've got personal problems that would knock down an elephant. And then you do that 8 hours a day and you come home and then you have to be healthy yourself after hearing all of these really hard stories. So I think learning practices for self care as part of medical and psychological and public health training will be helpful.
Absolutely. I'm so inspired to hear about these studies and also psyched. I've been a super fan of the Healthy Minds research initiatives at University of Wisconsin-Madison and Richie Davidson's work for like decades. So that's very exciting. Also, because I actually see majority physicians and other healthcare providers in my practice. So you're absolutely right. That was my service to the world during the pandemic, was just keeping all the ER docs going as they faced these overwhelming challenges. But it really inspires me to hear that you integrate this into your own personal life as well as your research program. And this is very exciting. We'll have to pick up on the name of your surgery resident. I want to hear the results of that study when it finally is published. That sounds super
Yeah,
interesting.
check back in a couple of months. Paper's been submitted, but I can't really talk about any details.
I
Sydney
totally
Towns.
get it. I'm so excited to get like advance notice. I'll be watching for it.
Cool.
So, just in closing, Dr. Barrett, what actionable steps would you recommend to those who are listening who want to start integrating mindfulness and climate action into their daily lives right now?
Um, get some training, practice. There's lots and lots of different avenues towards health. And even within the meditative sphere, there are many different options. Some people love to do the body scan every day. Some people hate the body scan. Some people love sitting meditation. I don't. I do standing or movement. Find the practice that works for you and keep at it. Don't blame yourself when you don't practice it because that doesn't help anybody. You might be inquisitive or curious. Why didn't I practice for this last week? Oh, I was too busy. That's okay.
Mhm.
Those things I was doing were important. So find a practice and keep with it is the biggest thing. If you can do a physical exercise practice while you're doing a mental mindfulness type meditation practice, that might be helpful. We're just talking about doing research in that area now, forming a group and running through different study models of how we might study whether we can do physical activity and meditation at the same time or sequentially in order to improve or magnify their positive effects. Find you need a body practice. Your body requires of movement. It requires where most people are too inactive. So you need to be physically active. You need a disciplined meditation practice of some type. You don't need it. People can be healthy without that, but it's helpful for most people. And then think carefully about your own life and how it's impacting which parts of your life you want to improve. You can't improve everything. Even if you have 10 things that you want to improve, you can only pick on one or two at a time. And maybe when you're getting really good at recycling, which has very little impact but is important, you can move on to reducing, or you can move on to biking rather than driving, or reducing water consumption, or getting an electric vehicle, or meeting, carpooling with friends if you can't take a bus or bike, insulating your house. Joining an organization and working towards positive change in the direction that you believe in can be very empowering, and collectively, you can have real important impacts.
I just love that you have really practical, actionable steps that we can take to both resource ourselves personally for eco wellness, but also be empowered to take action and not succumb to overwhelm or cynicism in the face of the way our planet is changing. Thank you so much, Dr. Barrett, for your intentions, for your skill, for your dedication in this research and developing these programs to be of benefit both to humanity and our planet. It's an inspiration.
Thank you. It has been a pleasure talking with you, Kimberly.
Thank you for tuning in to another transformative episode of The Art and Science of Thriving. If today's discussion resonated with you, don't keep it to yourself. Share this episode with family, friends, and anyone who could benefit. Remember, transformation starts in the mind and has the power to ripple throughout your life and the world in amazing and unexpected ways. To go deeper, visit our website to explore meditations, classes, retreats, and resources designed to deepen your connection to flow and to open to thriving like never before. Don't forget to subscribe and leave a review to help us spread the word and foster a community of growth-oriented, flow-loving individuals. Until next time, keep trusting the flow.